Hello guys, welcome back to Metabolic. So in this video, we'll be discussing up to question number 288 of the Fmge July 2025 recall. And guys, this is our new channel and please subscribe and share our channel so that it will be helpful for us and motivate us to make more such content. So now if you have any queries and please do mention it in the comment box. So the remaining 12 questions are very confusing and I'm not getting them. So guys, I need your help and please do help me in the comment box, or you can check out my Telegram channel and the link is there in the description. Now moving on to the questions. A young patient experiences shortness of breath specifically during exercise in winter, which subsides after using salbutamol. This is due to exercise-induced bronchoconstriction triggered by cold air. Next question. What describes stage 3 in the diagram? It is an image-based question. Answer: efflux of potassium ions. Next question. Neuropraxia refers to intact axon or damaged axon and damaged nerve sheath. Next one, a 12-year-old presents with short stature. On evaluation, bone age is found to be less than the chronological age. There are no dysmorphic features and the child is otherwise healthy. Diagnosis is constitutional delay of growth and puberty. Next question, a 9-month-old baby is brought to OPD. Which developmental milestone is likely to be present? Answer: creeps well on hands and knees. So guys, if you're someone who is preparing for Neetpg 2025, then this video is also helpful for you as well, because nowadays Fmge questions keep coming up in Neet. So it's helpful for you if you have a quick go through of these questions. Next one, which of the following is harmful to a newborn? Answer: giving a bath immediately after birth. Next one, a 4-month-old infant comes to emergency department with respiratory rate of 66 per minute along with chest indrawing and nasal flaring. Baby is not feeding. What is the diagnosis? Answer: severe pneumonia. Next question, a child presents with recurrent sinusitis and repeated lung infections. Genetic test shows a mutation in the CFTR gene. Gold standard to confirm the diagnosis is sweat chloride test. Next question, a 2-week-old infant presents with high conjugated bilirubin levels, dark-colored urine and clay-colored stools. Infant appears jaundiced but is feeding well. Diagnosis is biliary atresia. Next question, recommended treatment for esophageal varices is endoscopic ligation. Next question, a 25-year-old man with headache, visual disturbances and hypertension. MRI shows cerebellar hemangioblastoma, renal cell carcinoma. Suspicion is also present. His father had similar condition and died at 40 years because of a brain tumor. Chromosomal anomaly related is deletion of chromosome 3p. Next question, a patient underwent split thickness grafting for a burn injury on the arm. On post-op day 6, he developed stiffness of the arm during physiotherapy. Next step is continue physiotherapy without intervention. Next question, a young girl whose leg was fractured. Triage category is green. Next question, a patient is in shock. Next step, crystalloids followed by blood transfusion. Next one, a patient with diarrhea and exophthalmos. What is a condition? Answer is Graves' disease. Next one, an undiagnosed hyperthyroidism patient. Perioperative complication is arrhythmia. Next question, a patient after MI developed broad QRS complex tachycardia. BP is 90/70. ECG is given. Management is amiodarone IV. So guys, regarding this question, where 267 question, it's a doubtful one. So if you guys have more idea about it, please do mention it in the comment box. Next one, GBS, that is Guillain-Barré syndrome, AIDP. Cause is demyelination of the A beta fibers. Next one, 24-hour urine metanephrine values are elevated in a patient and BP is 180/100 mmHg. Diagnosis is pheochromocytoma. Next question, a patient with osteoarthritis for the last 3 months is taking ibuprofen and has developed occult GI bleeding. Cause is prostaglandin E2 and prostacyclin production reduced. Next one, a patient with chronic hypercalcemia for last 1.5 years but parathyroid hormone levels are normal. What is the cause? Answer: sarcoidosis. Next, a patient with amenorrhea and galactorrhea. MRI shows pituitary adenoma. Prolactin levels are also increased. Management is bromocriptine. Next, a child with progressive pallor and bone pain has elevated HbS, and best treatment to manage hemolysis in this patient is voxelotor. Next, a patient with M spike on serum electrophoresis. Prognosis is determined by albumin and beta-2 microglobulin. Next, a patient with HbS-Ag positive, IgM and HbC negative, and IgG anti-HbC positive, and HbA-Ag positive. Best treatment for this patient is lamivudine. Next question, an RTA patient is passing red-colored urine. Which of the following can be seen in him? Answer: hyperkalemia. Next one, a patient after RTA has a renal shutdown. FeNA value is less than 1% and urine osmolality is 500 milliosmoles per liter. Diagnosis is acute tubular necrosis. Next one, a patient is in ICU is in ICU after a failed attempt of subclavian catheterization. BP drops and pulse rises. What is the diagnosis? Answer: pneumothorax. Next, a patient with progressive shortness of breath for last 6 months accompanied by dry cough. Auscultation revealed bilateral basal and inspiratory crepitations. There's no history of fever, joint pain, or occupational exposure. Next, diagnosis is idiopathic pulmonary fibrosis. Next question, a child presents with Kawasaki disease with multiple large coronary artery aneurysm. Treatment is aspirin for 6 weeks. Next, a patient presents with brain hemorrhage. NCCT shows intracranial bleeding. Person has contralateral face, arm, and leg weakness. Location of the CNS bleeding is basal ganglia. Next question, CSF showed abundant neutrophils with low sugar and elevated protein. Diagnosis is ABM. Next question, a skin graft was done on an immunocompromised patient from another immunocompromised patient. Weeks later, patient developed contractures and systemic symptoms. Causes: graft versus host disease. In question number 287, ABM stands for acute bacterial meningitis. So that's it, guys. 288 questions are described, and please provide me with more questions so that we can compile all the 300 questions in the correct manner, and after that I'll be giving you the PDF, and we'll be also making it up the subject wise format. And if you're someone preparing for Neetpg, you can check out my Neetpg 7 years PYQs compilation on YouTube. And if you want a last minute revision, then the PDF is also available at a very nominal price, and I'll also provide you with coupon codes, so you can check out them in the description. The link is there. So that's it, guys. Till I come back with my new video, stay tuned. Till then, bye.